All right, welcome. In this explainer, we're going to cut right through all the noise and distill more than 240 studies on oral hygiene just to give you the most clinically relevant, evidence-based recommendations out there. It's a question we should all be asking ourselves, right? So let's dive into a comprehensive review of the latest research to make sure the clinical advice we're giving is absolutely on the cutting edge. Okay, so here's what we've got on tap. We're going to start with the foundational principles. Then we'll tackle some of the biggest clinical debates, zero in on high-needs patients, and then finish up with actionable takeaways you can use in your practice right away. So, just so you know where all this is coming from, it's all grounded in an article called The Science-Backed Guide to Perfect Oral Hygiene. This thing synthesizes findings from over 240 peer-reviewed studies. So yeah, we've got a really solid evidence-based foundation to work from here. Now, before we get into the nitty-gritty of comparing tools or talking about specific patient groups, we've got to nail down the one single principle that all the research points back to. It's absolutely foundational. The evidence really breaks it down into two complementary approaches. But let's be clear, they are not created equal. On one hand, you've got mechanical cleaning, the actual physical removal of biofilm. And on the other, you have chemical agents, which play a super important but definitely supporting role. And this really is the key takeaway from all of this research. The physical disruption, the actual removal of that plaque biofilm, that is the non-negotiable cornerstone of oral health. Everything else, it just builds on top of that. Okay, so that naturally leads us to one of the biggest questions we get from patients, right? What is the absolute best way to clean between my teeth? And the science is pretty clear. The answer isn't just one tool. It's a clinical decision that we have to make for each individual. So if you look at the data, it's actually pretty nuanced. Interdental brushes, they show the highest efficacy for plaque removal, making them a go-to for patients with open embrasures. Water flossers are a fantastic option, especially for folks with limited dexterity or implants. And good old traditional floss, it's still really effective for patients with tight contacts if they have good technique. See, our job is to match the tool to the patient. Okay, now check this out. This is a super recent and clinically significant finding from a 2024 trial. It turns out that for patients with moderate gingivitis, water flossers were actually better than interdental brushes at reducing bleeding after just 4 weeks. That's a huge piece of data to have in our back pocket when we're making recommendations for this specific group. All right, on to the next big debate, powered versus manual brushes. So, does the evidence give us a clear winner? Well, the answer is yes and no. It really depends on who the patient is. When it comes to our pediatric patients, the data is crystal clear. We're talking a 22 to 26% greater reduction in plaque with powered toothbrushes. That is a massive clinical advantage you just can't ignore. So here's the final verdict from the research. For kids, the evidence is overwhelming in favor of powered brushes, especially those oscillating rotating models. Why? Because they make up for still developing motor skills. Now, for adults with perfect technique, sure, a manual brush can be just as good, but let's be real. For most people, powered brushes just offer better consistency. And they're absolutely essential for anyone with dexterity challenges. Okay, so let's pull all this together and see how it applies to two patient groups that need our most specialized guidance, our youngest patients and our elderly patients. For kids, the evidence really highlights a few critical points. It all starts with getting that fluoride dosage just right, a tiny rice grain size for toddlers and then up to a pea size for preschoolers. And just as important, maybe even more so, is active parental supervision. The recommendation is up to age 10 to really make sure the technique is good and they aren't swallowing the paste. Now, when we shift to our elderly patients, our whole strategy has to change to address a whole new set of challenges. We're often dealing with things like reduced dexterity, big anatomical changes like larger embrasures and root exposure, and then you have the compounding factor of xerostomia. It's a whole different ballgame. So all of this leads to a really clear evidence-based protocol for their mechanical care. Step 1, recommend a powered brush to help with those dexterity issues. Step 2, bring in a water flosser as the main interdental tool because it's just easier to use. Step 3, supplement with the right size interdental brushes for any larger spaces. And step 4, and this is so important, we have to actually train any caregivers on simple, effective routines. And this is where we see a huge strategic shift. For this group, those chemical adjuncts, they're not just supplementary anymore. They are absolutely essential.
You've got a European consensus panel backing chlorhexidine for care-dependent patients. And high fluoride toothpastes become our #1 defense against root caries. It's a total change in approach.
All right, so we've gone through a ton of evidence. What does this all mean for you on a practical level? What are the key things you can take into your practice on Monday morning?
Okay, here's your clinical summary. Number 1, always anchor your patient education in the fact that mechanical cleaning is king. Number 2, individualize your interdental advice. It is not one size fits all. 3, make a strong evidence-backed recommendation for powered brushes, especially for kids and the elderly. 4, be proactive with high fluoride and antimicrobials for your at-risk seniors. And finally, and this might be the most important one, remember that the best oral hygiene plan is the one a patient will actually do consistently and correctly. And as we wrap this up, the research kind of leaves us with this really interesting question for the future. What we've talked about today is the current gold standard. But with things like AI-powered feedback and microbiome data just around the corner, well, it looks like we're headed for an even more precise and personalized era of preventive care. Pretty exciting stuff.